Continue our discussion now with Dean Baker from CEPR. What are the main Democratic candidate hopefuls proposing, and what do you make of their proposals?
Well, there aren't huge differences on their explicitly stated position. They all have very similar health care plans. Again, you sort of have to look at them and think, who's going to implement, what are they going to do to implement what? Because everything will happen after they take office. But they all have proposed plans which will get us towards universal coverage, if not actually at universal coverage. They're all, in effect, payer pay plans that employers will have to either insure their workers or pay a fee to have the government towards insuring those workers. And then on top of that, they have a government plan that people will have the option to buy into. So they're all similar in that respect.
And will the plans that are being proposed by the main Democratic Party candidates, will they lead to a solution to some extent for ordinary people?
Well, the problem's really going to be in the nuts and bolts. If you have a good public plan, then people have the option to buy into it. So what that would mean is basically people have the option to get into a Medicare type system, as long as you police it and make sure that's a good public plan. And my guess is, again, if it's done right, then you'd end up in a situation where the public plan would fairly quickly drive out the private plans. Something similar to what happened within Medicare itself. So if you go back to the mid-90s, the Gingrich Congress had their Medicare Plus Choice program where they expanded a role for the private insurance industry within Medicare. Well, very quickly, almost all the companies that jumped in at that point dropped out because they said they couldn't make money competing with Medicare. That's why when you go back 2 or 3 years ago when the Republicans put in the prescription drug benefit, they had their Medicare Advantage plan, which gives subsidies to the private insurance industry so they can compete with Medicare. So if you can create a situation where you go, fine, you want private plans to be in there, fine, let's have them in there, but they're going to compete on a level playing field, they lose. So that's the key.
There's one thing that distinguishes if I understand it correctly, the Edwards and Clinton plan from the Obama campaign. A plan is one is mandated, one is not. Can you explain what that difference is, and what do you think is more advantageous to ordinary people?
Well, the difference, Edwards and Clinton have a mandate requiring everyone to be insured. So it says you're either insured by your employer or you pay for insurance yourself. Again, there's subsidies for low, moderate income people, so it makes it more affordable, but for a lot of people that would still be a fairly big cost. So they have a mandate on that. Obama says no, he doesn't want to have a mandate. Now, to my mind, the key issue about a mandate is it essentially prevents freeloading, because there's a logic with insurance that, suppose, I'm relatively healthy and I don't have much by way of doctor's bills, I might very well say, well, why should I throw money down for insurance? I'll pay out of pocket. And then next week, if I suddenly find out I'm really sick and I'm going to have big bills, well, then I'll sign up for insurance then. Now, you can't do that today because the insurers won't take you if you're sick. But a key part of all these plans is that they would eliminate that. Everyone would pay the same regardless of pre-existing conditions. So that's why you need some sort of anti-free riding measure. The mandate does that. It says everyone has to pay up front. Obama actually has another way of doing it. What he's saying is you're just going to penalize someone. So if I'm going to say, well, I'll just pay out of pocket, and then if I get sick, I'll come down that day and just sign up for insurance, he penalizes you. So you would pay maybe twice as much. So that would be a pretty good disincentive to try and game the system. So I actually think that Obama's way of dealing with that can be a reasonable way. And one of the problems when we start talking about this is you get into a lot of nuts and bolts that are going to be difficult for most of the public to follow because they're not sitting here in Washington watching all the details.